Welcome to our show, Health and Wellness, Myths and Facts. I'm Ambika Singh Kama. A few weeks back, it seemed that the COVID pandemic was in its last stages and we were hopeful that it will end soon. But the emergence of Omicron has thrown all our projections of 2022 into disarray. Even though we have a variant that causes a mild infection, it can affect the vulnerable and the unvaccinated population. Due to Omicron's high rate of transmission and danger to unvaccinated and unboosted people, hospitalizations could rise dramatically in the coming months. People with chronic diseases should be more careful about the management of their conditions during this phase. Lifestyle diseases share risk factors similar to prolonged exposure to three modifiable lifestyle behaviors: smoking, unhealthy diet, and physical inactivity, and result in development of chronic diseases, specifically heart disease, stroke, diabetes. Each year, more than 15 million people die from non-communicable diseases between the ages of 30 and 69 years. These diseases were supposed to be adult-onset diseases, but the younger population is getting diagnosed with diabetes and heart disease. Awareness about such lifestyle disorders is important in a young population. We have our panel of experts to guide our youngsters about the management of lifestyle disorders. So if you have any questions you would like to ask them, please send them to us via WhatsApp to the number which is +91 9167 666 941. Yes, that's the number to send us your questions for our experts. Do also send us your name and your location. Let me introduce our guests. We have with us Dr. Arcojit Ghosh, MBBS, MD, DIP, MSc Diabetes, CCE, BDM, Diabetes, DECC, Endocrinology, Consultant Physician and Diabetologist, ISPAT Hospital, BP Podar Hospital, Iris Hospital, Kolkata. And we have Dr. L. Meenakshisundaram, MBBS, MD, MCCP, MA, IMS, PG, DIP, DIAB, Consultant Physician and Diabetologist, LM Medical Center, Chennai. Thank you all so much, doctors, for joining us today. Dr. Ghosh, starting with you first, new findings about the spread and severity of Omicron are emerging daily, with recent research pointing to a higher rate of asymptomatic spread and lower hospitalization risk. So should we really stop worrying about Omicron?
Good afternoon, everybody. Absolutely not. I would say absolutely not. See, Omicron is a milder variant. There's no doubt about that so far. But nothing has been unveiled too much about Omicron. It's just a 1 month experience, tell you what. So I would say now very recently we have got a B2 variant of Omicron, which might escape the RT-PCR tests as well. Also, with this being an RNA virus, and it spreads like anything, and it is prone to very frequent mutations, we do not know. From Omicron, we may get another variant which may endanger lives again. It may not. I reiterate, it may or it may not. So still put your guards on. And by guards, I would say not to depend too much on what government order says, what political parties say. Put your own guards on. Self-protection is the best protection. It will spread, no doubt, but let us protect ourselves. Let us protect ourselves. Self-protection is the best protection.
Absolutely, Dr. Ghosh, like you rightly said, not to let our guards down, self-protection, maintain all COVID protocols, and not to take it lightly, even though the hospitalization and severity is less. Dr. Meenakshisundaram, can a person with diabetes who has got COVID infection just 3 months back be vulnerable to the Omicron infection? In fact, this is a viewer question. We've got it on WhatsApp.
Yeah, see, the answer is yes, actually. See, unlike the older viral infections, such as measles, mumps, rubella, smallpox, chickenpox, and polio, where you get the infection once, you get lifelong immunity most of the time.
Yes.
But COVID does not do that. Even if they get once, they might still get it again. Okay. It doesn't offer lifelong immunity. Second thing is, the virus undergoes frequent mutations. So even if somebody develops neutralizing antibodies to Delta virus, for example, they are still prone for Omicron. So the most important thing is to protect against Omicron. Vaccinate yourself, take both the vaccines, take the booster shot if you're eligible, and follow the COVID-appropriate protocol, including social distancing, masking, and sanitizing. And for diabetic patients, keep your blood sugars under very good control. Because in a diabetic patient, the risk of getting the COVID is the same as a diabetic and a non-diabetic. But once a diabetic gets it, the chances of getting complications or getting admitted are much higher. So that is very important to keep the blood sugars under very good control. So for best protection, take your vaccines, follow the COVID-appropriate protocol, and keep your blood sugars under good control. Okay, thank you.
Okay, yeah, thank you for explaining that. Just a follow-up question on that, Dr. Meenakshisundaram, that tell us that you're saying that one could get Omicron. It's not like an infection or a disease which repeatedly you can get it again. So what if somebody has recently got Omicron? Do they still need to get the third dose or the booster injection immediately, or should they wait for some time?
So they can wait for 4 to 6 weeks, but they should take the booster dose. Booster dose is very important. The advantage is when they take the vaccine, the severity of the disease is less, the hospitalization is less, the mortality is less. That is the most important, advantage of taking the vaccine. So people should take the vaccine.
So vaccination is key here. Moving on, Dr. Ghosh, type 2 diabetes is usually more commonly seen in middle-aged or older adults. Can you get type 2 diabetes in your 20s? And what are the risk factors or warning signs that young people should look for in case they could be getting diabetes very soon?
See, this is actually a misconception prevailing that type 2 diabetes is only found in middle-aged people. It's wrong.
Okay.
Type 2 diabetes can affect anybody whatsoever, whosoever. See, the first thing you have to keep in mind about the 20s getting diabetes, most important history you have to take is if are the both parents of the patient diabetic. This is a very important thing. Both parents diabetic is a very important thing. Girls with PCOS background, they are very prone to develop type 2 diabetes.
Okay.
But again, I would always say that whenever to all physicians around, all the general practitioners around, whenever you are getting patients who are diabetic, who are in their 20s, please look for other forms of diabetes also. Look for LADA, look for MODI, look for a delayed type 1 diabetes also. Please do a proper diagnosis and then proceed. Type 2 diabetes can happen to anybody. I am reiterating this point again and again.
Yes, and that is a very important point, which means also youngsters should not take it lightly. Type 2 diabetes can happen at any age. And so more importantly, that youngsters also follow a healthy lifestyle. Moving on, Dr. Meenakshisundaram, heart attack and cardiac diseases have remained a major health concern around the world. But it is only recently that a rising number of heart attacks among the younger population are being reported. What could be the reason for this? In fact, what we were just discussing, even with diabetes, we see the younger population as well. So tell us about the heart ailment.
See, that's an important question. See, when we were students 30 years ago, we used to think of diabetes and heart attack only in people who are in their 40s or 50s. But of late, every day, we see youngsters in their late 20s, 30s and 40s getting admitted with acute heart attacks. This is a worrying trend. The reasons are multiple. There are several studies which show that Indians get heart disease 1 to 2 decades earlier than the Caucasians. The reasons are multiple. One thing is the genetics. Genetics loads the gun, and the environment and lifestyle changes pulls the trigger. So being an Asian as a race with a high-fat Indian phenotype, with increased visceral adiposity, predisposes us to early heart attacks. On top of this, if young people develop obesity or have a sedentary lifestyle, take carbohydrate-loaded junk foods, and the smoking is there, and the prolonged sitting is there. Sitting is supposed to be the new smoking now.
Yes.
So people sit for a long time, that is another risk factor. And apart from that, uncontrolled diabetes, hypertension, dyslipidemia, all of them predispose youngsters to heart disease. And in addition to that, increased high levels of stress, lack of sleep, interfering with the sleep-wake circadian rhythm by working for US time and Europe time, all of them are predisposing our bright youngsters to heart attacks. So they should be extremely careful. We should address multiple risk factors to protect our youngsters.
I think you've explained that really well, Dr. Sundaram. Just a follow-up question. You've told us that sleep is important, eating well is important, of course, maintaining a healthy lifestyle, avoiding stress, sitting is the new smoking, so one needs to be more active. Just tell me something, that what are some tests, especially for the youngsters? What could they actually, can they find out? Because they always say prevention is better than cure. Are there any tests which they could actually go and do to at least, find out if they have any heart issues, or if they are, if they're going towards it?
So, see, one thing about diabetes, both diabetes and its complications are silent. So people shouldn't wait for symptoms. Proactively, regularly, they have to check for the complications of diabetes.
Okay.
At the minimum, they can do a ECG once in 6 months. If they've got multiple risk factors, they can go in for a treadmill test once in a year or two. Okay. And then they can have an echo to see the cardiac function. Okay. Advanced testing, a CT angio and all can be decided by their treating physician if required. So in addition to that, they have to screen for risk factors. They have to check the lipid profile. They have to check for the HbA1c. see for the diabetic control, check for the hypertension, keep it under good control, check for albuminuria and proteinuria, which will predispose them to heart disease. So these things have to be done routinely, even if they have no symptoms.
Okay, so routinely checks do definitely help. Moving on, Dr. Ghosh, is it possible to not have diabetes at all after getting detected with pre-diabetes? This is also a WhatsApp question from our viewer. Unfortunately, we do not have the name, but yes, a viewer would like to know that.
This is a very important question. See, first of all, in India, pre-diabetes is not detected very often because the screening tools in India are very weak. In US and UK, they are very strong and pre-diabetes is detected. But please get this bone in mind. Diabetes, the pathophysiology of diabetes, the pathogenesis of diabetes, which is actually contributed by two most important factors. One is the insulin resistance and second is the loss of beta cells. Insulin resistance comes first, then the loss of beta cells follows it up. But this pathophysiology, diabetes, we say, never sleeps. The pathophysiology will proceed and definitely the patient will develop diabetes. So if we get a patient of pre-diabetes, we always say that be under strict medical nutrition therapy or MNT. Some data suggests you can give MNT with metformin, some suggests metformin alone, but pre-diabetes will definitely proceed to diabetes. Only thing you can delay it. But please keep in mind that you have to undergo regular checkups as recommended by various bodies, and please keep your sugars in control as long as you can without medications. But definitely pre-diabetes will proceed to diabetes.
So pre-diabetes will proceed to diabetes. Obviously, one needs to keep a check on the diet, like you rightly said, and of course maintain an active and a healthy lifestyle. So on that note, we're going to be taking a very short break. We'll be right back. Welcome back. You're watching Health and Wellness, Myths versus Facts. Starting with you again, Dr. Meenakshisundaram, are there different treatment protocols for managing diabetes in young adults compared to elders?
See, when it comes to treatment protocols, between the young adults and elderly, they are more or less the same, with significant differences in the targets, in the drugs we use, and the overall aim we have. For example, if a 70 to 80-year-old male who has had a heart attack, who has had a heart failure, with mild renal dysfunction that comes to us, we may not aim for a very tight control for him. We may have a relaxed control. We may keep the HbA1c between 7.5 to 8%. We may give him, easier protocol to follow so as to improve his quality of life. The same thing, if a 30 years young IT professional comes to us, the approach is totally different. Here, the strategy we follow is hit early, hit hard, bring down the blood sugar as low as possible, keep the HbA1c below 6.5%. And several studies have shown that the first 5 years of diabetes, if you have excellent control, the long-term complications significantly come down. So our aim is to reduce the blood sugars as low as possible during the first 5 years. Second thing is, we would like to offer them multiple risk factor control, including control of hypertension, dyslipidemia, all of them. Third is, in 2022, we have excellent drugs called SGLT2 inhibitors and oral semaglutide, which not only reduce the blood sugar, they also offer cardio-renal metabolic protection. So we give them drugs which will protect the heart, protect the kidneys and the other vital organs. So this is the main strategy. As far as young people are concerned, we hit early, hit hard, bring down the HbA1c as low as possible, keep it below 6.5%, offer them multiple organ protection and use latest drugs which will give them multiple benefits.
Okay. So that's about the treatment, but Dr. Ghosh, if I ask you about the symptoms, when younger people are detected with type 2 diabetes, do they have severe symptoms or are they very similar to what the elderly have, or do they develop, and also do they develop complications sooner?
See, one thing we have to remember is that type 2 diabetes is type 2 diabetes.
Yeah.
It doesn't matter if it is happening in a young patient or an old elderly patient. Yeah, the targets are different. The medications given, the other factors may be slightly different. All diabetic patients are prone to develop microvascular and macrovascular complications. However, if nowadays the treatment of diabetes is not just glucocentric, as Dr. Sundaram said, it is also cardio-metabolic centric as well, cardio-nephro-metabolic centric as well. We actually give drugs which will protect the patient from any hazardous cardiovascular risks, any renovascular risks, and any other complications.
Okay.
They have to be protected as well by the same oral hypoglycemic drug, and so all the young patients should be offered the benefits of these new drugs, because the treatment of diabetes, which was there in 2010, is entirely different now. It is in 2022. It is a much broader aspect. It's a much compact, and it covers most of the things. Yeah.
Okay, so the younger populations should take advantage of the new medication, the new technology and the new drugs.
Absolutely.
Yeah, okay, that's I think a very important point put out there. Dr. Sundaram, are young adults with diabetes more prone to heart attack? What are the early signs that they should again look out for?
See, diabetes is not only increased blood sugar level. Diabetes is a cardio-renal metabolic syndrome associated with increased vascular complications. Having diabetes itself is a vascular risk factor. So diabetic patients are more prone for heart disease. So they should be extremely careful. Irrespective of the age of the patient, any diabetic is prone for cardiac complications. Especially young people with multiple risk factors such as obesity, hypertension, smoking, as I said, prolonged sitting. Those who have junk food, intake of junk food is very common now. Carbohydrate-laden, fat-laden junk foods are quite common now. That can increase heart disease risk. And then stress, lack of sleep, all of them predispose the young people to heart attack. And coming to the symptoms, most of the time they may not have major symptoms. As I said earlier, it may be a silent disease. People have to proactively check for heart disease. The second thing is, because of diabetic neuropathy, people may not get the classical symptoms like chest pain, sweating, breathlessness may not be there. They may have non-specific symptoms. They may have gastritis, they may have epigastric burning, nausea, vomiting. So a high index of suspicion is required in a diabetic. Whenever they get any symptom related to the heart, immediately meet a physician, have an ECG done, do a cardiac enzyme, rule out the cardiac event. It's absolutely important.
So there may not be symptoms, but if any symptoms do prevail, one should immediately consult a doctor. And obviously, one must keep a check, what you rightly said, we must try and live a healthier lifestyle. Dr. Ghosh, what is the right way to measure obesity in children, and what are the factors that contribute to the increase in child obesity? Because we're really seeing that, huge number of kids in our country are obese. Why are they at more risk to develop lifestyle chronic conditions?
See, the best method of measuring obesity is by looking at the child.
Okay.
You know that this birth child is fat, so it is obese, it's done. There are other measures also, like BMI, body mass index. Now, body mass index is also a crude method because it does not include height. So we also take the weight is to height ratio. We actually measure the visceral fat. We measure various other things. The patient, whether we assess whether the patient has metabolic syndrome. But the most important fact is, if the child is obese, now, which is very common because in our days the children used to go out and play. Nowadays they don't.
Yes.
They are very much limited to sedentary style of life. But if a child is obese, please consider the following things. One, if the child is diabetic, if the child is hypothyroid, if the child has any other concurrent inborn error of metabolism, or any other metabolic diseases at that time, you have to also assess if the child has any genetic disease, which is actually rendering him or her obese. So better to consult an endocrinologist right away if you find your child is obese, and especially if he is abnormally obese. You are not expecting the child to be obese because maybe he has got good activity all around, he or she has, but still you find that the child is not losing weight. Please consult an endocrinologist immediately for a detailed workup of the child.
And like you rightly said, I think children do need to be more active at this point rather than just sitting and, of course, more on the electronics, but yes, eating right. And parents, of course, if they feel the child is obese, they should not take it lightly. Moving on, Dr. Sundaram, is it true that strenuous exercise raises the short-term risk of heart attack and cardiac arrest?
The answer is yes. Actually, we all know exercise is the best strategy we have against lifestyle diseases, including diabetes, heart disease, and hypertension. But however, it should be a mild to moderate intensity exercise. Strenuous exercise may not be good. Sometimes it may cause harm, particularly certain set of patients. For example, those who have underlying structural heart disease, who have hypertrophic obstructive cardiomyopathy, who have dilated cardiomyopathy, who have constrictive pericarditis, or those who have arrhythmias. For example, atrial arrhythmias, atrial fibrillation, ventricular arrhythmias, or those who have congenital QT prolongation syndromes, or those who have uncontrolled hypertension, those who have chronic kidney disease. This set of patients should never do strenuous exercise. Because strenuous exercise can cause an adrenergic surge, which can lead on to a cardiac event or cardiac arrhythmia. So they should always avoid it. Even though exercise is best, you should be very careful. Before you begin any exercise program, meet your physician, check your cardiac status, bring down your blood pressure, blood sugar and lipids, and then start. And then start it low and go slow. Don't be in a hurry. Do it under supervision. Be extremely careful. Exercise is the best thing you can do, but you'll have to do it under supervision and be careful about it.
I think that is key. What you said, exercise is very, very important, but it must be done in moderation and under supervision and knowing what really suits your body. Thank you all so much, Dr. Ghosh and Dr. Sundaram, for joining us today and sharing your expertise with us and our viewers. Thank you all so much for watching.